imani. Yeah.
Ladies and gentlemen, according to a recent survey conducted in March 2018, 84% of Kenyans support devolution, with only 13% opposing it. This shows that Kenyans are confident in the health system under the county leadership to deliver the promise of access to quality, affordable, and accessible health care to all. A lot of effort has been made to profile maternal, newborn, child, and adolescent health highly in the county health agenda. This has seen health care forming one of the single largest components of county budgets. County governments have recorded notable strides in this sector and are not only investing in health facilities and equipments, but are also directing monies to primary health care, both the preventive and promotive aspects, so that we can reduce the high costs incurred in providing curative care. Northern counties, for example, are making deliberate efforts to encourage women to deliver in health facilities. Such investments have paid off. We have witnessed a huge drop of up to 39% infant deaths per 1,000 live births. On the other hand, we have also seen an increase in accessibility to specialized medical care for diabetes, renal care, and cardiovascular care. But as you are all aware, the delivery of the health function has seen its dark days. In the late 2016 to mid-2017, we witnessed a number of industrial strikes that left the sector paralyzed for over 100 days. Many Kenyans who relied on public health care were left stranded, and an estimated 500,000 children missed important vaccines. We are happy with the President's 100 Days Rapid Result Initiative, RRI, for vaccination, which was launched in July, which has significantly covered the unimmunized children and restored the country back on track with regards to immunization. As you are all aware, nutrition is a vital building block in the foundation of human health and development. Nutrition has a direct relationship with child survival, physical and mental growth, learning capacity, adult productivity, and overall social and economic development. According to 2014 Kenya Demographic and Health Survey, stunting, wasting, and underweight had improved as follows. Stunting, 35% to 26% in that period, that is 2008 to 2014. Wasting from 7% to 4%, and underweight from 16% to 11%. I'm happy to inform you today that counties are putting in place measures and developing nutrition action plans to accelerate and scale up efforts towards the elimination of malnutrition as a problem of public health significance in Kenya by the year 2030. We know that for better service delivery to be achieved by counties, many challenges have to be overcome, especially now that universal health care is among the Big Four agenda, and counties have embraced and are implementing UHC through various initiatives. I take this opportunity to convey the assurance of the Council of Governors and the county government's commitment to maintaining the momentum and focus towards ending preventable maternal and child deaths by the year 2030 and improving reproductive, maternal, and newborn health.
I don't say this lightly because I was part of this journey back in 2014. She brought 15 county governors together at a meeting on the 26th of August, 2014. 15 counties of Kenya out of the 47 contributed to 98% of the maternal deaths in this country. Kenya was considered then amongst the 10 most dangerous places for a woman to give birth. What the First Lady of Kenya, ladies and gentlemen, did was she essentially brought the issue of adolescent health, of maternal health, of the plight of the girl child from the periphery of our consciousness to the center of public policy. If we do not have that kind of political will and momentum, these results would be very, very difficult to achieve. So essentially what Kenya is doing is in many ways trailblazing. It is actually showing a new dimension of what can be done to transform this. And I want to acknowledge that because of this initiative that she took, the UK government and Norway unlocked about $15 million from a trust fund in New York. And the H6 partners, UNFPA, UNICEF, WHO, UNAIDS, World Bank, came together and went to the 6 remotest county, of which Dr. Kuti is one of them. 6 counties of Kenya, Mandera, Wajir, Marsabit, Lamu, Isiolo, Garissa, accounted for 50% of the deaths in this country. A county like Mandera had a maternal mortality ratio of 3,795 deaths per 100,000 live births, ladies and gentlemen. What does that mean? If I were to just put that into an equatable form, in wartime Sierra Leone, there were 2,000 deaths per 100,000 live births. The fact that we've come down from 466 to 362 is an indication that these last at the bottom end of the 6 counties, how they've transformed it. And it is purely because of devolution. It is purely because of the leadership that we've seen from the national government, from the First Lady, from the Cabinet Secretary of Health, the President Kenyatta's own personal push, and the county governors in this kind of transformation.